Thank you for watching and welcome back. Now, hospital-acquired infections are an increasing problem worldwide. They cause harm to patients, putting the very notion of safe health systems in jeopardy. This week on Health Digest, Gloria Miliwi looks at what it takes to fight these pathogens that not only compromises the safety of patients in hospitals, but also the very staff who take care of them during their stay in hospital. Take a look.
Hospitals are considered safe places where the sick seek treatment, recovery, and care. Yet behind their sterile walls lies a quiet threat. A threat that also acts as a breeding ground for hospital-acquired infections, causing harm to patients and health professionals who take care of them. These microscopic enemies that threaten global health and compromise health systems can be transferred from one patient to another or hitch a ride on the hands and equipment of the very staff who look after patients during their stay in hospital. But have you ever wondered what guidelines health workers adhere to when caring for patients in order to prevent these infections that occur 48 hours or more after a patient is admitted to a health facility? Professor Rodney Adam, who chairs the Infection and Prevention Control Committee at the Aga Khan University Hospital in Nairobi, offers a rare glimpse into the rigorous process of busting these infection-causing bags in hospitals to ensure these facilities remain places of healing, not harm.
90% of the preventable infections can be prevented with hand hygiene. So that's really the central part of any hospital effort. Germs that are spread are most often spread through the hands of healthcare workers or others. So that's one of the critical parts of infection control. For single-use items, we don't reuse them. And we use them properly if somebody has a Foley catheter, for example, there are ways to hold the bag so that the urine doesn't flow back in and become contaminated.
He explains that contamination can also arise from multi-touch surfaces. These compromised surfaces, which include door handles, bed rails, and even switches, can harbor harmful microorganisms. In order to reduce the risk of cross-contamination, hospitals rely heavily on environmental hygiene as an essential line of defense designed to stop the spread of these pathogens in their tracks before they reach their next host.
For the individual patient, we make sure they have clean laundry without contamination. We make sure that the room that they move into has been adequately cleaned so that there's no residual germs that are likely to cause problem. In a room with patients with certain kinds of infections, you would go another step. There are some bacteria or viruses that are very resistant to drying in the environment, and there you would have to do more rigorous cleaning, usually including bleach within the cleaning solution. So again, it depends on exactly where you are and what kind of risk you're trying to take care of.
Healthcare-acquired infections are said to be a daily threat in every hospital and clinic. The World Health Organization estimates that up to 3.5 million patients could die each year from these infections without urgent action.
Part of the control.
Infection control experts like Professor Adam and his counterpart David Odada are constantly fighting an invisible enemy, one who lurks in the shadows, waiting for an opportune time to strike. They can also be present on reusable medical devices. More often than not, When the bright operating theatre lights blur and consciousness fades during a countdown to surgery, most patients are unlikely to be pondering the odds of an unsterilized instrument being used. But infection control specialist Odada warns that the risk of infections is greater in cases where inadequate cleaning, disinfecting and sterilization of these reusable medical devices happens.
Cleaning can either be manual or we have automated washers. And the washers basically use a detergent as well. So it is automated. There are conditions that these washers would actually meet as far as temperature is concerned, as far as the time that is required for decontamination is concerned. We can either have hot sterilization or cold sterilization. Hot sterilization utilizes steam. And then cold sterilization, we have an equipment that is called plasma. That one uses, now it's called sterilization because it uses hydrogen peroxide. And the reason for this is the equipments that are heat sensitive.
How the sterilized equipment is handled afterwards is also critical to the health of the patient whom the medical devices will be used.
Packing would involve putting equipments according to a certain recipe. And we use the term recipe just to talk about the load for the specific surgery that it's going to perform. So different surgeries require different equipments. So they are going to be arranged in a certain way in a container. And one thing that we do is that we are going to put in, during packing, something we call a chemical indicator. And a chemical indicator is actually a device that is supposed to show you that actually the instrument have been sterilized. Once that is packed, outside again, we have another chemical indicator.
On the other hand, for healthcare workers, the risks are also glaring. Needle pricks make up one of the most reported injuries among this cadre, followed by exposure to blood and body fluids. Overall, healthcare-associated infections hamper efforts to achieve high-quality care for all. They impact on healthcare costs and fuel the dangerous rise of antibiotics resistance, premature deaths, and disability. To break this cycle of cross-contamination in healthcare settings, experts advise the need to constantly train health personnel on infection prevention and control, paired with constant surveillance for emerging infections, and only through sustained awareness, discipline, and monitoring can healthcare facilities reduce these risks and protect their patients and staff. Gloria Miliu, KTN.